Warm welcome to all of our esteemed speakers who have taken their seats on the dais, and we also extend a warm welcome to the esteemed speakers who have joined us online. So before we move on, a quick introduction to our esteemed speakers. Mr. James Dalton is Director of Global Water and Wetlands Team at the International Union for Conservation of Nature, a water policy expert. He leads global initiatives on freshwater ecosystems, nature-based solutions and integrated water resources management. Mr. Ravi Singh is Secretary General and CEO of WWF India, a veteran conservation leader. He has spent over 3 decades advancing biodiversity protection, climate action and sustainable natural resource management, strengthening WWF India's partnerships and science-based program to support India's environmental sustainability and ecological resilience goals. Mr. Casper Mayland is a Counsellor for Environment, Political and Economic Affairs at the Royal Danish Embassy, New Delhi, a Danish diplomat. He advances India-Denmark cooperation on climate, green transition and sustainable development, supporting policy dialogues, strategic partnerships and bilateral initiatives across environment and economic domains. Ms. Ulrike Kelm is Deputy Executive Director at the International Water Resources Association and an experienced communications and water sector professional. We have already met her in the morning as well. So once again, a very warm welcome to you. We warmly welcome Dr. Akash Srivastava, Additional Director and Head of the Center for Environmental and Occupational Health, Climate Change and Health at the National Center for Disease Control under the Ministry of Health and Family Welfare, Government of India. He is a public health expert and leads national initiatives on climate change and human health, environmental health policy, and health system resilience. We warmly welcome Dr. Paras Pujari, Chief Scientist and Head of the Water Resources Group at CSIR National Environmental Engineering Research Institute, a hydrogeology and water quality expert. He leads research on groundwater management, contaminant remediation, and sustainable water solutions, advancing science-based interventions for India's water security and environmental protection. So let me extend once again a very warm welcome to all of you. So we start with Mr. James Dalton. Mr. Dalton, if you're online with us, if you can hear us. I guess not. So we'll quickly move on to our next speaker. Meanwhile, we'll see if Mr. Dalton can join us online. So may I request Mr. Ravi Singh to please take it forward and share his thoughts with us.
Namaskar everyone and thank you. I think in cricketing terms, I've been pushed up the ladder to open the batting in this session after lunch. And I'd start by saying something which I think is obvious to many of us and like to reiterate. Firstly, that this conference on ESG, on water, energy, health and environmental nexus, the interconnectedness and the topicality of this is well known amongst most of us today. It's not something that we are introducing. These introductions happened perhaps about a decade or so ago. And as a result of what's happening in India, a lot of the work that's gone on the ground and with sectoral interventions in industry and government policy and government implementation has gone far ahead. In fact, I personally believe that when we see presentations by Indian participants internationally, a lot of our work is way ahead from what people actually envisage we would be. And I think here the country's impact on this issue of climate change and climate process is way ahead than what we ourselves talk about or market. I'll just be brief in this because I don't think it's a time for detailed instructions. I have taken some notes and I will not take the detailing on, but just the few points I'd mention. Firstly, that whenever we do any of this from the experience of a lot of the agencies who are here our partners, including the work that WWF India does across the country. We need to be integrated in our strategies, and a lot of the work that needs to happen has to be on a landscape level. Meaning, for instance, whenever we look at a supply chain methodology, the interconnectedness of where it starts, where it is being offered to a consumer, going back all the way to where it emanated and what the footprint of that is, needs to somehow, we need to understand and integrate. I mean, things like commodities like palm oil, timber, pulp and paper, agri-commodities, these are well known and these are integrated aspects that actually come to us. And we see some of these in issues of trying to reduce nature and climate related risk. Water efficiency is another aspect of landscape level planning in corporate parlance, in corporate strategy. Whenever we look at water or water management and the immense strides that have been made by Indian industry in this area, there still needs to be a modicum of understanding what a basin level approach is to water. Basins which lead us to examples of what can happen both on the ground as well as in terms of examples of policy impact that can follow. For instance, clean flowing rivers need a basin approach, and water in our country is so vital as it is everywhere else in the world, but we are also interconnected with it in terms of industry, agriculture, agro-industries, downstream effects, fisheries, and a whole list of issues that we have. And here, the impact of the working with the National Mission for the Clean Ganga, the Ministry of Jal Shakti, several state governments including Uttar Pradesh, Punjab, Tamil Nadu, we managed to look at various examples of impact both on industry, energy footprints, businesses like leather, textiles and others so vital to our country's economy, metalware, and taking a landscape approach to be able to show the interconnectedness of all this. The rivers that I'm talking about here are the Ganga, the tributary of the Ganga, Ram Ganga, Satluj and Noyal. Noyal is near Coimbatore. Secondly, the ecosystem-based and nature-based approach and nature-based solutions should be treated as key infrastructure. So while we are interconnecting this and we're looking at transferability of a lot of the topics that we have in front of us, we need to try and see how nature-based solutions and others, while protecting, say, for instance, wetlands, mangroves, floodplains, it helps us to manage floods, recharge groundwater and purify water. In all this, what is not being discussed sufficiently, and I think there is a portion which will be taken on in the future, in the coming sessions, is the approach of One Health. And that while we're talking about aspects of water, resilience, all these things are interconnected to our main topics, the approach for One Health should be considered and integrated. This involves considering risks from zoonotic and waterborne diseases in land use planning, wildlife management, and water quality initiatives. These are very key in our work. I think some of the challenges, of course, in India is to integrate the planning process and to bring the agencies together to be able to go to a certain objective. And also recommendations taking forward, joint risk management, investment planning, shared data, integrated early warning systems, etc. To all this, I just mentioned one thing which does not occur anywhere else in the world. To most Indians, I would say to all Indians, the cultural aspect of combining water, energy, health and environment is actually integrated in us. And this integration does not require introduction as to why we need to do something or the other. I think what is missing in our time is the process for how we are going to do this. And sometimes even the how is known and we need to take it further forward. Lastly, I'll just say that I wish on a lovely day like this, this time of the year, some of us could meet in the field, actually, to see some of the processes going forward, both in agriculture as well as industry, and the kind of solutions that India is undertaking to take some of these aspects forward. Thank you.
I now invite Mr. Casper Mayland to kindly articulate his thoughts.
This one is working-ish? Yep, perfect. So thank you very much and good afternoon to everyone. Thank you for India Water Foundation for organizing this and also for cutting the lunch short. I will mainly be talking about the water energy nexus. The main point is probably that's because it's one of the areas that I know something about, but I think also, as also was being mentioned by Mr. Ravi here, that it is already so interconnected, so maybe you don't even have to talk about the nexus or the full circle. I mean, let's look at the Jal Jeevan mission, for example. I mean, yes, it is about securing clean tap water to the villages, but the underline here is evidently it's a health issue, so that people are not drinking contaminated water and so on and so on. And the same thing goes with the environment, of course, as well, when we talk about the clean Ganga and wastewater and treatment of that. This morning and last evening, I was looking a little bit on some of the numbers here from India, just trying to understand the grasp of it. And what at least I saw, and of course numbers can be slightly inaccurate or depending on where you look, then it's up to like 10% of India's energy consumption is related to water. It's 10%. Maybe it's 8%, maybe it's 7%, but it's a huge number. At the same time, the non-revenue water that is lost in the pipe somewhere after it's been pumped up from the groundwater or from the Himalayas, wherever it is, that loss is up to like 35%. It's a huge number. So take those two numbers together. I mean, one thing is we are spending a lot of energy in pumping the water up, treating it, yada, yada, yada. And at the same time, some of this water that we are treating and yada, 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 is being lost before it reaches the customer. The same thing goes with, I think it's with the wastewater. It's only, and this is a number, correct me if I'm wrong here, but around 30% of the total amount of wastewater here in India is treated. That means that 70% of the water is not treated, and that has a huge impact on health and on environment, and also, and this will be one of my points, actually on the energy consumption that we see here in India. I also saw a number here saying 50,000 crores annually is being lost in revenue or wasted energy or in environmental losses because of the non-revenue water as well. So what I'm really trying to say here is that there's quite a few low-hanging fruits that could be tapped into if, I'm not saying if we want it, because I think everyone here in the room, they're sharing the same agenda, but at least if we can make the push that's needed. At the same time in Denmark, it is not to brag, I think these are just numbers and there are reasons why it is looking like that, then less than 2% of Denmark's energy consumption is being used for the water management, including treatment of wastewater. At the same time, the non-revenue water is roughly 5 to 7%. So it's different numbers, and of course there are reasons why the numbers are like that, because we have tried to put in quite a few government policies forcing whoever is working within the water governance to reduce the energy costings as much as possible. And more interesting, it's because we're also looking at the savings that are ending up at the eventually buyer. You don't want to buy expensive water if you can do it somehow cheaper. So that being said, in general, I would say that we somehow in Denmark, we represent at least energy efficiency because or efficiency, because we have been working with these issues for the last 100 years, trying to really enhance it. And at the same time in India, I really see the scale and some of these low-hanging fruits. The point that I'm trying to make, to be fairly honest here, is also that there's a good area here for collaboration, and it's not only between Denmark and India. I mean, it's all partners across, because there's a lot of learnings to be learned from each other. So when I'm looking at least the partnership that I'm responsible for, and that's the water partnership between Denmark and India, it's not that I'm saying that in India you should copy exactly what it is we're doing in Denmark, but you should be inspired that it is possible to lower the non-revenue water. It is possible to look at energy savings and so on. Just to come up with 2 examples, through our engagement with the government of Tamil Nadu, we did a training of trainer course on energy audits within the water supply. Basically what we do in Denmark, you have a water utility, you have some engineers, they assess their own water cycle themselves, and they would look at where can I save. Ideally it is probably money, but money equals energy. So we conducted this kind of training together with the government of Tamil Nadu for their own officers. And what they have done now is that they have looked and identified, I think it's the 50 most inefficient pump systems, where they have now made a tender to replace these pump systems to something that's more efficient. And the efficientness is not about finding the cheapest pump or the most expensive, but it's looking at the entire lifespan and energy consumption of a pump compared to the water that it needs to move. They have done that by going into a public-private partnership, which I also find interesting. So if you look at the CapEx and OpEx, I mean, this is a fairly easy way to look into it, because here you ask partners to come in, invest in a new pump, and then we share the savings afterwards. So I find that as a fairly easy, low-hanging fruit to look into. Another thing is also the wastewater treatment plants. In Denmark, not all, but we're moving into it. Most of the wastewater treatment plants we have, they are energy positive. That means that they create more energy than the users. That being said, I do also understand why not all wastewater in India is being treated, because it's just another expense that you can put on your budget line. If you build a new wastewater plant, I mean, one thing is building it, but it's also running it, and especially within the energy consumption. So there we're also looking into, together with the government of India, how to make at least some blueprints, how to retrofit the already existing energy plants or wastewater treatment plants, but also how to update newly built ones and so on. So that's just 2 of the examples on some of the low-hanging fruits that are there. I mean, I could go on, but of course we also have to skip to the next session. So basically what I want to say here is that when we talk about the water, energy, and also health and environment nexus, we should not only look into the silos, because yes, I'm interested in water, but suddenly when we're looking at water and want to have a more efficient water supply, we're suddenly moving into the domain of energy. And when we're suddenly moving into those things and talking about wastewater treatment plants, we're suddenly working into the environment and the health nexus. And I just find that very interesting, and I hope that would also be a little bit inspiring to not think about all of this in silos, but try to be interconnected across the entire cycle, you might say. That's all I had to say, and with that, I wish everyone a happy Friday when we all come that far. Thank you.
Thank you for sharing your thoughts with us. We will be coming back to you, but first we have a speaker who's with us online. She was already online. So Ms. Ulrike Kelm, if you can hear me. Yes. So it's over to you. We are eager to hear from you.
Thank you very much. Can you hear me? This is the normal question. Thank you for nodding. Thank you. So thank you very much for inviting me to speak today. So ladies and gentlemen and distinguished colleagues, it's really a great honor to address you today on behalf of the International Water Resources Association. My name is Ulrike Kelm and I am the association's Deputy Executive Director. And I would really like to start beginning with thanking the organizers, especially the India Water Foundation, for bringing us together here in New Delhi. And when I say here, it means like I feel like if I was there with you. Unfortunately, I cannot be with you. And I had truly hoped to join you today, but because the conference brings together an extraordinary community of people working on the forefront of water, sustainability and human well-being. But well, at least I can connect remotely and can join the discussion, so thank you for making this possible. This plenary session too on navigating the interdependencies of the water, energy, health and environment nexus raises the critical issues we all are confronted with every day. We just heard some very good examples from my fellow speakers here in the panel about One Health, the energy nexus and collaboration. I would like to begin with a simple story. Just imagine a city facing an extended drought. The reservoirs are running low. The water utility must pump water from deeper groundwater sources, which requires more electricity. At the same time, the region's hydropower production decline because river flows are reduced. Energy prices rise. Hospitals begin to worry about maintaining reliable services, and farmers downstream struggle to irrigate their crops. Meanwhile, ecosystems along the river, wetlands that filter water and support biodiversity, begin to degrade. What started as a water problem quickly becomes an energy problem, a health problem, and environment problem. And this is the reality captured by what we call the water, energy, health, environment nexus. We are all aware of that. It reminds us that water is never just about water. It is about systems that sustain our societies and our planet. In global policy discussion, this understanding has become increasingly central. Within the framework of the United Nations and their Sustainable Development Goal 6, water and sanitation are recognized as essential foundations of sustainable development. But the influence extends far beyond that single goal. Water is equally vital to SDG Goal 3 on health, to the SDG 7 on energy, to the SDG 13 on climate action, to the SDG 15 on ecosystem, and so forth. The Nexus perspective simply makes visible what communities around the world experience every day, that water connects everything. It connects the electricity that powers our homes with the rivers that sustain our ecosystems. It connects the safety of drinking water with the resilience of our health systems. It connects climate change with the livelihood of farmers and the survival of wetlands. And when one part of this system is stressed, the impacts cascade across the others. Recognizing these connections is also central to the mission of the International Water Resources Association. Over 5 decades, the International Water Resources Association has created spaces where scientists, policymakers, and practitioners and communities can come together to share knowledge and address complex water challenges. Its vision of a world where water resources are managed sustainably, equitably, and with sound science reflects that very spirit of the Nexus approach. Because the challenges we face today cannot be solved within silos. Hydrologists cannot solve them alone. Energy planners cannot solve them alone. Public health experts cannot solve them alone. And environmental scientists cannot solve them alone. But when these perspectives come together, when knowledge flows across disciplines and across borders, solutions become possible. This is precisely what organizations like the IWRA enable: global dialogue, shared learning and collaboration that recognizes water not as an isolated sector, but as the thread that connects our systems and our futures. And this is why this conference today is so important, to connect. The spirit of collaboration will particularly be important as the global water community prepares for the 2026 United Nations Water Conference in December, which will once again bring governments, scientists and civil society together to accelerate progress on water and sanitation. So perhaps the lesson of our drought-stricken city at the beginning of my intervention is simple. If we want resilient energy systems, healthy communities and thriving ecosystems, we must begin with water and with the understanding that water connects us all. Water connects our planet, our societies and our future. So our solutions must be just as connected. Thank you very much.
Thank you, Ms. Kelm. Water does indeed connect us all. So we move on now to Dr. Akash Srivastava, Additional Director, Center for Environmental and Occupational Health, Climate Change and Health, and also National Center for Disease Control, Ministry of Health and Family Welfare. It's over to you, sir. Please kindly share your thoughts with us.
Good afternoon, everyone. So the topic that we have today on water, energy, health and environment nexus, the interrelationship of these four sectors have been felt for a very long time, but they have even more become prominent in the times of climate change. We realize, especially as someone who myself work in the climate change and health sector, how important it has become to work together in these four sectors. Fortunately, in India, at the senior most government level, we have, under the vision of the Honorable Prime Minister, a Prime Minister's Council on Climate Change, which brings together not only the senior ministry representatives of these four sector-related ministries, but also of many other important ministries, which provides an important policy platform for them to interact and discuss on the interactions of these sectors. But that's not the only place where we get these opportunities. We have various other platforms and committees where the representatives of these ministries interact with each other to discuss the interaction and find solutions, how they can work together towards helping the population of the country. Speaking specifically of some of this area, especially say water and health, safe water has always been recognized in the health sector as an important predictor of health. India has for a very long time been facing a number of disease outbreaks related to acute diarrheal diseases, which mostly has been related to unsafe water. While over this period of time, the Ministry of Jal Shakti has done a wonderful job through their Jal Jeevan mission of providing safe water to all households in the country. We in the health sector have also worked together with them by developing an integrated health information platform where we are able to collect information about the diarrheal diseases, related cases and outbreaks across the country. More than 2 lakh plus reporting units across the country in the public sector, and many more private sector units now report on this platform. And we have worked together with the Ministry of Jal Shakti. Recently, there has been an agreement between both ministries in which there was a joint standard operating protocol agreed upon by the two ministries, so that both the health sector officials as well as the water sector, whether it was rural water supply or PHED department down at the state and the district level or at the sub-district level, could jointly work towards understanding as to why unsafe water was causing a problem. If any, they could jointly investigate and take actions on it. Both the water ministry, which has got a water quality MIS, and we at the health sector, who has got an IHIP, have made an understanding to share the information with each other at all levels, from the district to state to the central level, so that we can understand the issues of water and health together and take actions to safeguard the health of our people when affected by water and health issues. In the context of climate change, it is not always about the water quality, it is also about the water quantity. We need safe water. While the Ministry of Health, through other initiatives, in which Catch the Rain initiative, they are trying to motivate the population towards rainwater harvesting. We also, through our health sector, have taken up the initiative so that all our health facilities enforce putting up rainwater harvesting systems in place to have safe water and sustainability in terms of water. Beyond water and health, there are other areas such as in energy and health, which is another important area of work. While in India, we have a national solar mission working on providing alternate, safe, renewable energy. We also, in the health sector, are through the initiatives trying to see that our health facilities are capturing solar energy so that they have available energy at all times. Energy is very important to run the health services. Unfortunately, in a large country, there are areas which are located in remote locations where energy is an issue. And at that places, we need that there being energy sufficiency, we have to look out for alternative sources of energy, wherein solar energy is a very promising energy to help these health facilities. In context of energy, we also recognize that it is not only important to have energy, but why renewable energy? Because like any other sector, health sector also contributes to up to 5% of greenhouse gas emission. So if we proceed towards renewable energy, we are also helping by becoming a much less contributing to greenhouse gas emission. So solar energy is also one of the efforts that we are making, and the Pradhan Mantri's Ghar Surya Yojana is helping the health facilities to reach this ambition. In terms of emission, as I was speaking, we've also recognized how the Ujjwala Yojana initiated by the government has helped to a large extent, helping the women and the children to save their health against the impact that they used to have when they were exposed to unsafe air while cooking at home. Provisioning a clean source of energy for cooking has helped these women and children to safeguard their health. We in the health sector, in the context of energy, are also working interrelatedly with climate change related matters. Coming down to the next topic is environment and health. Environment and climate change, two important areas, especially we all are aware of how the problem of air pollution has in recent time picked up in this country, and the impact of both air pollution as well as climate change on health has a huge cost for the public health. And to work towards that, there have been many schemes that have been put in place, both by the Ministry of Environment. There is a National Action Plan on Climate Change by the Ministry of Environment, Forest and Climate Change. They also have a National Clean Air Program, and we are trying to bring around good quality air for the citizens. We, as the Ministry of Health and its sector, also support the Ministry's initiative in context of health. We have a National Action Plan on Climate Change and Human Health initiatives, which are, together with the state governments, have put in place state-level action plans on climate change and human health, which define as to what initiatives we can do to safeguard the health of our population from the impact that climate change has. One of the big impacts is also in terms of extreme weather events, and the National Disaster Management Plan by the NDMA, as well as the initiatives that have been taken by the Ministry of Health so as to protect the health of their people at the time of extreme weather event, is working towards this initiative. The National Health Mission that we have in place and the National Urban Health Mission that we have in the Ministry of Health has a large number of programs that works for specific health-related issues for the people. The Pradhan Mantri's Ayushman Bharat Health Infrastructure Mission has worked towards provisioning of a huge number of health facilities to provide health care. At the same time, the Pradhan Mantri's PMJ program provides for health insurance to safeguard the health of the people. To ensure that we have in place a digital health mission. We are also helping towards safeguarding the emissions through the huge network of telemedicine and telemanaged programs that we have, which protect the people from traveling, which helps in reducing the numbers of emissions. So in short, I've been trying to say that there are a lot of initiatives that are being taken by other ministries as well as by the Ministry of Health in context of water, energy, health and environment nexus. But of course, beyond the government sector, there is also a need in India for all other sectors to come together and hold our hands so that we can together make better efforts in this direction. Thank you.
Thank you, Dr. Srivastava. We now move on to our next speaker, Dr. Paras Pujari. It's over to you, sir.
Good afternoon, everybody. Hello. It's not working. Hello. Yeah. Good afternoon, everybody. First of all, thanks to Dr. Arvind Kumar for this opportunity, and it's an excellent platform which brings policymakers, corporates, and research institutes and academics, on the same platform. And it's extremely relevant, and fellow panelists have also discussed about this Nexus approach, and fully agree with Dr. Ravi Singh's view that water should be discussed at the basin level. This is what I think that should be the approach, not administrative wise, but as a basin scale or a watershed scale. Basically, that is how we can treat it. And in fact, I'm going to discuss on this water, energy and food nexus that's from the central India. I think all of you know about the famous Nagpur orange. And it's grown in parts of Nagpur and parts of this Chhindwara and Amravati, all these regions. And the hub of this orange plantation is area called Narkhed. That's approximately 70 kilometers from Nagpur. And this research study on water, energy and food nexus, basically we are doing it under the umbrella of critical zone research. So critical zone is basically, it's the zone which extends from the top of the tree canopy to the bottom of the active groundwater zone. And this is the zone, which gives us all the services necessary for our survival. The provisioning services, it gives us water, food, fiber, everything. Supporting services, soil formation, this nutrient cycling, everything. Then regulating services, we have trees, which are very important, carbon sink. Then we have recreational services, lakes, water bodies, everything. And all these services have to be in harmony for our survival. If we try to maximize one service at the cost of other, then there will be environmental degradation. So one need to have a systems-based planning to manage these different services. And this is what basically we have to do in our Nexus approach. And this is how, critical zone approach is very similar to how we need to have a Nexus approach to solve this water, environment, health, and this thing. And it needs multiple disciplines. It needs soil scientists, hydrogeologists, geophysicists, terrestrial biologists, limnologists, social scientists, policymakers. All have to come together because the problems cannot be solved by one discipline. So in CSIR-NEERI, we have been doing this research study for the last 7-8 years, and I'm going to discuss about this particular study. So this is about that region where we have set up our critical zone observatory, and this region has large-scale withdrawal of groundwater, basically. There is no surface water used, and it is the basalts, basically. which are not known to be promising aquifers. I mean, the groundwater occurrence and transport is controlled by the fractures. And the farmers, often they become so greedy that to maximize the yield from the wells, they do sort of horizontal boring to create additional secondary porosity. This is what people have been practicing for the last so many years. So we have tried to see, I mean, what is the water balance at a tree scale, basically. So we did set up an experiment wherein we installed SAFLOX sensors on the trees. So SAFLOX basically measures the root water uptake. And all these farmers, they are using this groundwater, and it was drawn through these electric pumps of 5 to 10 HP capacity. And when we tried to calculate the capacity, I mean withdrawal, it was something like 67,000 liters per tree per year. Huge amount of groundwater that is being withdrawn by using electric power. And when we installed the SAFLOX sensors and did the monitoring for one full year, we could see that the tree water uptake is approximately 1,000 liters, 1,500 liters per tree per year. So the tree does not require that much of water. I mean, it is 67,000 liters per year, but the SAFLOX measurements, it gives that it is giving hardly 1,500 liters per year. And when that water balance was done through a unsaturated zone modeling, we could see that 47% of the water was going as leakage. 12% was going as transpiration. And rest 40% was concentrated in the unsaturated zone. So this 47% that was going as leakage is something that is not desired. Because you are using electric power to draw a lot of water, and almost half of that is going back to the aquifer. So it is not just wastage of water, but it is basically wastage of energy. Then we tried to do some sort of irrigation residualing, which we worked out and found out that by giving some two different irrigation residualing, the tree will require approximately 3,000 liters per tree. So there will be a saving of 64,000 liters of water per tree. Of course, I mean, we have not monetized. Maybe we'll do that exercise by involving some social scientist or economist. But you can just see, I mean, what is the wastage of water. And this 47%, it is more than the irrigation return flow, which is, given by our regulatory, Central Groundwater Authority. They say that the return flow will be maximum 25 to 30%, but it was 47%. It was huge amount, basically. So this is, one evidence-based research that could come out of that study. And in this exercise, we had somehow convinced the farmer, who was growing these orange trees, and he was on board with us. Of course, he was fully cooperative. We did pay him certain amount to maintain these equipments. And when we asked him to implement our findings, he has shifted to drip irrigation, basically, and not compromising the yield as well as the quality. And he has been able to convince some of his family members also who have shifted to that kind of drip irrigation. So the issue is, it can be replicated, but if only there are other stakeholders on board with us. That is something that is lacking, so we are not able to reach the last mile, but we are able to somehow disseminate the research findings at a very local level. So, but this kind of research is necessary, but it can be only facilitated through synergy of different institutes, maybe the agricultural departments, academic departments, civil society members, and of course, these policymakers. And this requires huge investment basically. So research funding should not be given for 2 years or 3 years. If it is environmental monitoring, especially related to climate change, it should be long-term funding. So this is the message that I can have. Thank you.
Thank you, sir. And thanks to all of you for sharing your thoughts with us. And to do the honors of presenting the mementos as our token of thanks and appreciation, may I invite on stage Dr. Satya Tripathi. Okay. Yes. We thank Mr. Ravi Singh. Thanks to Mr. Casper Mayland. We thank Dr. Akash Srivastava. Our thanks to Dr. Paras Pujari. I request you all to please join us front and center for a group photo op. And of course, we take this moment of thanking Ms. Ulrike Kelm. She joined us online. If you can hear us, Ms. Kelm, we'd like to say thanks. Thank you all. May I request you to please kindly take your seats back amongst the audience. Backstage team to please prepare the stage. We quickly move on to our next session, which is Navigating Interdependencies of the Water, Energy, Health and Environment Nexus. This is again our thematic session. And the esteemed panelists for this session would be as follows. Dr. Ritesh Kumar, Director, Wetlands International South Asia. Dr. Alok K. Sikka, Country Representative, India and Bangladesh International Water Management Institute. Mr. Anshul Jain, Senior Expert, Water and SWM European Business and Technology Center. And Dr. Sutirth Saharia, Senior Vice President, Head of Communications, Sulabh International. And Dr. Hitesh Vaidya, who is the esteemed moderator, Chief Technical Advisor, India Water Foundation.